Ebola has now claimed the lives of more than 5,000 people in West Africa as the current outbreak continues. Last weekend, Professor John Wright became one of the first NHS volunteers to fly out to Sierra Leone to help fight the virus. He's been sent to a town called Moyamba, where he'll run a new Ebola treatment centre, and he's been keeping...
I was put in charge of setting up an Ebola hospital in Moyamba, which is about a 5-hour drive inland from Freetown. And I spent the first 3 weeks working with the Royal Engineers who were building the hospital, setting up the hospital, getting the drugs, the laboratory support, the nurses, the doctors needed to run it. And then about 3 weeks working in the hospital, looking after patients, experiencing this very, very strange, very infectious disease and learning how we could keep ourselves safe from it. Everywhere you go, there are security checkpoints. Every building that you enter, the security guards, but in place of guns, they've got these laser thermometers and they point them at your forehead and check your temperature. Any sign of a fever and you don't go any further. The second thing is that at the entrance and exit of every building, there's giant vats of chlorinated water. And then also working with community groups around in Moyamba, trying to encourage changes in behaviour around avoiding body contact, hand washing, fever monitoring, reporting sick patients. The Bradford Institute for Health Research was set up in 2007 in recognition for the need to boost medical research in the city, and it was a collaboration between the University of Bradford and the teaching hospital here. And it's been highly successful. We've grown our grant income from about £500,000 7 years ago from external grants, which is very low key, to about £10 million a year on medical research in the city. This has been a great brain gain for the city. We bring grants in, high quality research and high quality researchers. It's just what the city needs. And it's a great example of the partnership between a university and a hospital. So about 10 years ago, the hospital became a teaching hospital, and we were working in partnership with the University of Leeds and the University of Bradford to expand medical school training into Bradford. And at the time, that allowed us to get some resource about expanding our health research. We had very little medical research going on in the city, so a lot of health need, but very little research. So this was an opportunity to build a platform of research that will be attractive to researchers in the future. So we looked around us. We didn't have any fantastic ivory towers full of geneticists and molecular biologists and all these sort of things, but we did have this fascinating population in Bradford. So it's a large city, it's multi-ethnic, it's considerable areas of deprivation, and it's a fascinating area from a health perspective to study. It's like the TV series 7 Up or Child of Our Time. You know, we're just taking snapshots as they grow up. For about 4,000 children, we're following them up every year, weighing, measuring, doing skin prick testing, measuring their breathing, measuring their brain development. But for most of the children, we're just sitting remotely. We've got biological specimens, genetic specimens, and we've got very detailed history from when the mothers were recruited. And we're now following them up, linking to GP records and hospital records and school records to find out what the early predictors of success and health are. So Born in Bradford's, it's a medical detective story. We're picking up the clues early on and trying to find out who'd done it later on.
Welcome to Sierra Leone and this Ebola treatment centre paid for by British taxpayers and built by British Army engineers. It's hard to believe that just 8 weeks ago this 7-acre site was scrubland. Now it's a fully functioning treatment centre. Let me just show you around the place a little bit.
For me it was a very interesting experience socio-culturally, about how an epidemic can completely take over a country. So this is an epidemic that's destroyed the health service, destroyed the economy, destroyed the tourism industry. There's nothing left but Ebola in this country. It affects everywhere you go, so there's fever checkpoints every few miles on the road, there's hand washing before and after you go into every room. There's a no-touch policy, so nobody touches anybody, which is very strange as a human being.